Template administration in Prime Suite. Now we're going to talk about templates for your notes. This is a core module and very important as you will be writing plenty of notes on plenty of patients. You need to create and use templates. So go to Chart, Template Admin. There are multiple different types of templates in Prime Suite. First of all, when you first use this, your section over here will probably be empty. The good news is there are relatively few templates that you need. And most of them I will have you import directly, which you can customize later. Customization and design of templates will be focused in a different module, and really takes a lot of trial and error and a lot of time to create. So we're going to go over the simple things now. Correspondence templates you very rarely use. So generally when you click on to create a new template, this is what you'll see. You'll have a start, you'll have a note, you'll be able to preview it, and you'll be able to save it. Okay. Correspondence templates you'll very rarely do. Order templates, very infrequently will you actually use a template to do an order. Procedure templates, if you are doing a procedure, you can use a template for that. We'll go over those later. The biggest one that you'll use is a progress or a progress note or an H&P template. Whenever you write a progress note on a patient or an H&P on a new patient, you'll use a progress note template. Quick note templates, we use sometimes quick notes for simple functionality such as billing things on hospital patients. The first thing you'll want to do is you'll want to import some templates. So you're going to click over here on Import. And Prime Suite will load. And there's different places where you can import from. And if you want, you can import. Prime Suite actually has a library of templates. If you want to play around with it and see how these work inside and out, you're certainly welcome to go to the urology templates and document templates. There's a whole bunch of random templates which are here, the follow-ups and problems and all sorts of extensive templates that you can play with and customize if that's the way you want to do it. However, at Jersey Urology Group, we created several templates to simplify things. So I recommend that you use our templates for starters. So you're going to want to go to File, System, and Browse. This location is subject to change, but right now you're going to go to F, Greenway Templates. Okay. And in here are directories I have backed up of multiple templates. Truthfully, these should be and will be organized better in the future, but for now, I created a templates for new users. And what you're going to want to do is you're going to want to import all of these templates for starters. All right. And the way you do that is, unfortunately, you have to do them one by one. You're going to double click on the template that you want. It says Browse File System. You're going to click there, and it's going to say Current Selections, and then you're going to click Start Import. Okay, and after that's done, you're going to go back. Since I already have them, you're going to do the next one. Choose that one, Start Import. And you're going to go through every single one of them until you have all these templates. Pause this video until you've done all of that, and then once you have all your templates, they all should be listed in this area for you to see. Okay, we're going to go into how each template works. Before we do that, it's important that we establish physical examination templates. When you're writing notes, and we'll get into this in our clinical lectures, when you're writing notes, you're going to need physical examinations. And there's several types of physical examinations that you'll use depending on whether the patient is a new or an established patient. You're going to need to set those up. So you should have several examination templates. To list them, you should have follow-up, Horizon 3 with genital, Horizon 3 without genital, pelvic DRE, new exam, and genital. So we're going to take the first one. We're going to double click on this template to open it. Okay? Only for these physical examination templates, you're going to do these following steps, and then you're never going to have to do this again. You're going to go to PE. So these are the different sections of a note that you can edit, and we'll go in on how to do that much later. Physical exam, you're going to click here, okay, and you're going to see this is a new patient physical examination. This was designed by our compliance officer to meet the specifications necessary for a new patient examination. Okay, what you're going to do is you're going to click on type. You're going to then click on add new type. And then you're going to type in new patient exam and then click OK. And I'm going to click cancel for myself, but you're going to click OK. Then when you click under type, you should see new patient exam in this type. Okay? That's all you're going to do right now for that physical examination. Next, you're going to go back to template admin. We can get out of that. You're going to choose the next physical examination type. We're going to say, let's see, I'm not sure if I have them right here, but you're going to choose the ones that I asked you to import. You're going to choose genital male. You're going to double click on that one, or actually I have Horizon 3 with genital. You're going to double click on that one, and again you're going to go to the physical exam. Okay, under that physical exam, you're going to see a specific physical examination, which our compliance officer will describe in more detail to you. You're going to again click type. You're going to click on add new type. I'm sorry, you're going to click on save as. Not add new type, but save as. Actually, I think it is add new type. And then you're gonna type in, as we said, this is Horizon 3 with genital, and you can capitalize it, and you're gonna click OK. You're gonna do that for every examination type. So, and make sure that they all show up under type after you do that. Okay, you should have 6 types. You should have follow-up, Horizon 3 with genital, Horizon 3 no genital, male genital or genital, new patient exam, and pelvic exam DRE. As you get into your compliance and billing training, our compliance officer will go over what the different examination types should be used for. So I'm going to pause this video until you've done those steps. Once you've done those steps, you can continue. I'm going to go back to our template admin. All right, I'm going to go over what our various templates are. So just so you know, I had you import 6 different templates for examinations. You can actually delete those now. You don't need those anymore. So if you wanted to, you can click on whichever one it is, and you can click delete template, and it'll remove it. Okay. Base template we're going to go over. That is what I use for 99% of the patients who come into the office. You will probably want this modified and customized to suit your particular patient workflow. You may also want some simpler templates, which once you get more experience with the Greenway product, we can easily train you on creating and help you create. Some of these other templates that you've pulled in. Hospitalist. This is what we use to bill patients who we see in the hospital. Surgery center anesthesia procedures. This is what we use to bill procedures that we perform outside of the office. I also have this one, ESWAL ASC and USCOPE ASC. They're just simplified. You can actually use the surgery center anesthesia procedures for everything, but as a simplification, if you do a lot of ureteroscopy or ESWAL, the USCOPE has the correct codes already billed, or gives you the choices in a more direct fashion. So I find that easier to use for my stone patients. Testing appointments is an order type template that we use on patients who come into our office who have testing performed, but are and that have testing performed, and this is how you would create a note with appropriate billing charges, which we'll get into later. So if you are responsible for signing billing charges, that is the template I would recommend that you use. I'm going to go over the basic parts of a progress note template by using my base template that I had you import. So every template in template administration has a template name, template description, it's a base template, services category, and in this case it's going to be outpatient services, okay? It defaults to that. We generally don't use preventative medicine or special E&M services. You could easily use this for post-op global visit. Some folks use a special template, a simplified template for post-op visits, which is beyond the scope of this video. CC, enter possible complaints and check defaults. These are the standard complaints that patients come in to be seen for. Voiding dysfunction, stone dysfunction, etc., etc. You can easily add another option. We'll remove for now. You could also, if for some reason you're finding that you're getting a lot of kidney stones seen as new patients, you can default that it's checked. When you save this, it will default checked. I don't recommend you do that because if you uncheck it, it'll look like everyone is there for a kidney stone. HPI, ignore most of this that you see right there. But suffice it to say that the HPI will end up looking like this. This component over here follows the form that every patient who is an established patient or a new patient gets. It is essentially the AUA symptom score. You can click through this with the various numbers of the AUA symptom score in order to generate your visit. Okay, and this is just preview mode. You can preview what the template looks like. Our general template has that the patient comes in for, you either put in the patient's physician's name, self-referred, or follow-up visit. We'll just put that the patient's there for a follow-up visit. And then you would click through the AUA symptom score, 1, 3, etc., etc., etc. We'll say that he's pleased. Then you can put in the final score. Okay, it also has places for the patient has had hematuria, has been having dysuria, not having pain. You can change these appropriately when you actually write your notes, and this is how it ends up looking. There's also a place to review diagnostic imaging and lab work. Okay, that's the HPI. I would not touch this right now. Review of systems. This is also a standard. Okay, you may need to set this up separately, which I will help you with. But everyone has a standard ROS, which we'll go into later with the clinical lectures. You should not modify this unless you really know what you're doing. Physical examination, we discussed the different types earlier. Okay, and the way that looks in an actual template is you would actually go to physical examination and you would choose a test. It doesn't look like under the test it will allow me to do that, but so that's physical examination. Assessment. I put in standard codes that we use in urology. The ICD-10 codes with the corresponding ICD-9 codes if those are more familiar to you. But every single ICD-9 code needs to have an ICD-10 code. I put the most common ones at the top and less common ones at the bottom. It's very easy to add to this. So BPH, erectile dysfunction, nocturia, etc., etc., etc. Say we want to add one, we can do, let's see, renal cancer. And it'll add that one to our list. And then what you can actually do is you can move the corresponding codes up or down as needed. Okay? And remember, when you make changes, make sure that you save. Plan. We'll go over how to do the plans in a later lecture. The bottom line is you'll have some common orders that you can use to choosing your plan whenever you like. I also, with the base template, looks like it's for some reason giving me a hard time, but for each ICD-10 code that you choose in the assessment, you can actually have specific things that you want ordered, as well as instructions for each problem, which we'll go into as we do later on. So for example, someone with erectile dysfunction, possible labs that you may want ordered, hypogonadism panel. I can easily order something. Let's say I just want to do a testosterone, and in this case we want a total testosterone. I'll just add that. And again, if you want this, and you can ignore all these numbers and things that you see there are because of a lot of these codes have changed over the different editions of Prime Suite. So some of them may or may not need to be deleted. But for example, this testosterone is pretty standard. And if you want every single patient who you click on this diagnosis, testosterone, to get this diagnosis, erectile dysfunction, to have a testosterone, you can automatically check it. Okay. And just so you know what this means is, non-billable means we can't do it in the office. Billable means it is something that we do in the office. And you can put the default status usually should be ordered unless you're doing it in the office. If we do it in the office and you bill it, then you would change it to reviewed. Okay. I put in sample prescriptions. Now, these are out of date, but we have sample prescriptions for each problem that you can choose from. So when you choose an ICD-10 code, it'll make suggestions on what you may like. As well as various blurbs that you may say to a patient, such as the patient's complaints are consistent with erectile dysfunction, et cetera, et cetera, et cetera. And that will all show up in the patient's note. So if we went to preview and we chose erectile dysfunction, and then we go to the plan, we can ignore these script errors. Sometimes you will see those. We'll go to the note preview instead. Well, it doesn't want to show us. Oh, there we go. All right. Well, that is essentially what the note will look like. It's not showing the assessment portion, but that's okay. But that's essentially what the template looks like. And again, this is an older template, but it's pretty comprehensive in most of the problems that we see, and you can easily add to this. As you get more acclimated with Jersey Urology Group, it's very simple to create and edit your own templates, which we'll go over at a later time. And just to show you our hospitalist template. So this is, again, this is a way that we put charges into the system. So our HPI for this is a very simple statement which says that we're billing charges. You're not going to have a physical examination. Assessment, you have some simple ones to choose from. And plan, you're basically, as you can see, everything is billable. The whole point of this note is to essentially bill charges during a visit. So we have various levels of charges, which our compliance officer will go over with you on how to choose which one is correct, as well as consults. For certain insurances, we can still do consults. Insertion of urinary catheters, or if you insert a catheter, if it's complicated, that would be a code that you would choose. You would choose that in your actual template. And various common surgical procedures that you may do, usually by the bedside, we've left here for you to choose in your template. And that And again, it doesn't want to run, but that's okay. And that's essentially what it looks like. We'll show more examples of that later. And the surgery center anesthesia template, again, we can easily customize this for what you do, but I generally have it as procedure was performed today by me. Dictation code is, it'll have a little area for you to put your dictation code in. The assessment will be the patient's ICD-10 codes. If the patient has the ICD-10 codes in the problem list, it's very easy to import. And then under plan, it's going to be the codes. Plan is essentially not just what you're thinking, but what you're doing for the patient. So under the plan in your notes, just jumping ahead a little bit, but under plan in your notes, you're going to put medications, orders, as well as things that you have done for the patients that aren't in a separate results section. So plan is what you are going to do or have done for the patient. So in this case, these are various procedures that we do quite a lot of. It's very easy to add something to this list. I'll just give you a brief example. For example, let's say we want to add prostatectomy. We'll just do a retropubic prostatectomy, which we're not really going to do, a suprapubic prostatectomy, which we're not really going to do in the surgery center, but we can add that into our list. That will go to the bottom, and it's already defaulted for billing, that we do it, billing, and we would default that to reviewed, because this is after we've already reviewed and billed the procedure. And if we do a lot of them, we can highlight it and move it all the way up to the top. Okay, and then of course make sure that you save the procedure, the note, or you can save as and save it as a new type of note in case you want to have different types of templates in your list. And in this case, I'm not going to save this. And that is an introduction to template administration.